When the old student come back to their own schools, their own institutions, what a joy for all the teachers and principal. My dear students, parents, teachers and all the well-wishers, welcome back to another wonderful video. Our old student who completed 12 years of education at St. John's, now UG BDS at Sibar Dental College, proposed a wonderful dental camp, oral hygiene at the school level. And they visited the school. It was a wonderful experience for all the students and teachers. And our own parent, where her two daughters studied here 14 years of education from LKG to 12th class. Dr. Devaki Garu, Professor of Public Health Dentistry, Sibar College, visited with UGs and PGs around 18 students, and the professor, full day from morning till evening, checking with the student oral hygiene, teachers oral hygiene, gave the wonderful tips how to take care of those beautiful pearly white teeth which enhance your smile. My sincere thanks to all the Department of Public Health Dentistry, Sibar College, for conducting such wonderful camps at school level, where children will have an awareness to take care of their teeth, strong teeth, so that they can enjoy every chew, every bite of their food. And I do have these wonderful people talking to you, giving some hints about the oral hygiene. At the end of the day, they came to my office and they gave one simple statement. Madam, your school students have wonderful oral hygiene. Their oral health is superb. They don't even have a slight tint of any kind of food or caries. They're really taking care of their teeth. Thanks to my health club of St. John's English Medium School, we do have health clubs. We bring that awareness to every child. We don't allow chocolates from pre-KG to class 5 at school. Maybe at the parents' wish at home they can. We don't distribute also from pre-KG to 5th class. And high school, we are very much keen on not to have junk food, not to have unnecessary food which is coated with chemicals and all those unnecessary toxins which are in the adulterated food. So we avoid all this packeted food, fresh fruits, fresh food, homemade snacks. My dear students and parents, a sincere thanks for keeping up that oral hygiene and following the rules and regulations of the school. So when they said, your school students' oral hygiene is superb, ma'am, I felt honored. I felt very happy. Here are the glimpses of the whole dental camp at St. John's, and my sincere thanks to all the students and especially the old student of St. John's, Ramya Kodali. Be blessed. Have a nice day. your name?
My name is Prithvinand.
Okay, do you have any problem with your teeth?
No, ma'am.
Which class are you studying?
8th class.
Okay. At what time you brush your teeth?
7:30.
7:30. Do you brush it twice?
Sometimes I do twice.
Will you put excessive pressure on your teeth when you are brushing?
No.
How will you do brush your teeth like this?
No.
Aggressively?
No, not aggressive.
So these are your gums. This is your teeth, suppose. And if you brush your teeth, do it like this, the downward motion with 45 degrees angulation, so that if any food accumulates here, it will move off. Or if you scribble like this, the food accumulates and it may cause caries. Okay? If this is your down teeth, you do it like this.
Okay.
Okay? Will you do it twice?
Yes.
After you eat food, every time you can't brush your teeth. So just rinse it off, clean your mouth with water. What's your name?
Sheikh Nawaz Ahmad.
Which class are you studying?
9th.
Do you have any problem with your teeth? All fine. How many times do you brush your teeth?
1.
Once in the morning. How much time?
5 minutes.
5 minutes you'll brush. You should not brush for 5 minutes. 2 to 3 minutes is enough. And when you are brushing your teeth, suppose these are your upper teeth and this is your gums. So you keep it your brush for 45 degrees and then you do it like this. So that if any food accumulates here, it will go off. And if you do it like this aggressively, the food will go inside and that will cause caries to you. And if it is your down teeth, do it like this and up. Okay. Do you have any doubts?
Okay. What's your age?
My age is 12.
What is your name?
My name is V. Abhinav Srivatsa.
Okay. Do you have any teeth problems? No? No problems? Okay. I'll just see. Wait. Okay. Your teeth are very nice. You have to brush your teeth. How many times you will brush your teeth? One time. No, you have to brush your teeth for 2 times. Okay, morning and night. Okay, daily before going to bed you have to brush your teeth. Okay. Okay. What is the proper brushing technique? You know how to brush your teeth. You know. Okay. How? You just tell me.
Sliding like this and
No, I'll explain you how to brush your teeth. You take your toothbrush like this, add a groundnut size of groundnut, you know. So small size of toothpaste on it, and you have to brush your teeth in circular motions. Okay, you just place your brush inside and do it in circular motions. Okay, in all sides you have to touch your, this bristle should touch your tooth surface. Okay, from inside also same. Keep your brush inside like this and brush your teeth like this. Okay? In a sweeping motion. From inside. Outside circular motion. Okay? You have to brush your teeth twice daily. Okay? And eat good food. Okay? No chocolates, no sweets. Okay? Okay?
Even though if you eat the chocolates or food, just rinse your mouth with a little bit of water. So it
Okay.
will help you.
You can eat chocolates and sweets, but you have to gargle your mouth. Okay? Whenever you eat food, just gargle your mouth. That's a good habit. Okay? Fine. What is your name?
I am Harshavardhan Reddy.
Okay. What's your age?
14.
14 years. Do you brush your teeth regularly? Yes? Okay. How many times do you brush your teeth daily?
1 time.
Only one time. In the morning only? Okay. I'll just see. Once. Just come forward. Okay, good. Your teeth are very nice. You don't have any cavities. Okay. Okay. Do you know how many teeth are there in our mouth? How many teeth?
32.
32. For primary tooth, that means in children? Children, how many teeth do you have?
28.
No, we have only 20 teeth. After these 20 teeth go off, we'll get 32 teeth. Okay. Present we are getting only 28 teeth. 28 only. Okay. So total we have 20 in children and 32 in adults. Adults means your parents. Okay. After completing your by 15 years, you will get all 32 teeth. Okay. Do you know what are the parts of a teeth? What is this white color on teeth? You don't know? Okay. It's an enamel. You have three parts: enamel, dentin, and pulp. Okay. If any infection goes from enamel to pulp, you will get severe pain. Okay. So, in order to not get this decay, what do you do daily?
Brush out.
Yes, very good. How many times?
2 times.
Very good. How many minutes?
5 minutes.
No, not 5 minutes. You have to brush only 2 to 3 minutes. Okay? 2 to 3 minutes, 2 times daily. Okay? That's it.
If you're brushing for more time means your enamel will go off. So infection will be easily spreading into your
More brushing is not a good process. Okay? So brush only 2 to 3 minutes. Okay? Bye.
What is your name?
Lakshita,
Age?
14,
Which class are you studying?
9 years.
That's all. Open wide. Dental fluorosis. And DC in relation to 4/7. That's it. How many times do you brush your teeth?
1 time.
Only once. In which, like how you brush your teeth? Like this?
Yeah.
Okay, you brush your teeth. From now, you brush like round, and just from your tip of your what we call gingiva to your tooth, contouring. Okay. You brush for 2 minutes only. Don't brush hard. With soft brushes, you brush. That's it. You can leave. What's your name?
Irfan.
Age?
30.
Which class are you studying?
9.
Open your mouth. Wide. Open wide. DC in relation to 4/7, 4/6, 3/6 and 3/7. Three, 4/7. Calculus mild. No fluorosis. How many times did you brush your teeth?
One time.
Only once in the morning. Like how you brush your teeth. Yes. From now you brush your teeth roundward and you brush like only for 2 minutes you brush. That's it. You can leave.
What's your name?
Kavya.
Which class you are studying?
9th B.
Okay. Have you ever visited the dentist before?
No.
No. Can I check your oral cavity?
Yes.
Open mouth. Open wide. Everything is fine. Can you bite your teeth? Oh, backward. Okay. Everything is fine. Having doubts, you need to ask to me. No? Everything is fine? Yes. Okay, you may go. What's your name?
E. Roshni Devi,
Which class you are studying?
9th class.
Have you ever visited the dentist before? No? Can I check your oral cavity? Open your mouth. Having pain in your teeth? Have you eat chocolates daily? Okay. You need to stop that. The decay will be starting initially. Can you bite your teeth? Okay. You have to visit the dentist. DC. Open. initial. In addition to 2616. Have you visited dentist? Are you interested?
Yes.
Are you afraid of that? Okay, you may. Having any doubts to ask me? No? Everything is fine? Okay, you may go.
What's your name?
My name is Vilokesh.
How old are you?
I'm a grade 10 year student.
Do you have any problem with your teeth?
Like some gaps between them, I want to get this.
Okay, once. Where do you feel gaps? I don't find any.
Like when I close this mouth, some gaps.
There aren't gaps. Everything is fine. I don't find any decay or something.
Okay.
And you need to brush a little bit because the food you eat is getting dislodged in your teeth. Okay. Once, can you open your mouth again? Just improve your brushing technique.
Okay.
How do you brush daily?
Like 2 to 3 minutes or 5 minutes, some minutes.
Like, how do you brush? Do you brush in this way or do you sweep the tooth or?
Like only sweeping.
Okay, basically you have to sweep your tooth, okay? If this is brush and if this is your tooth, you need to sweep in this way, okay? Not in this way, sweep. So that food doesn't get stick to your tooth and they'll get cleared away very easily, okay? And ready. Okay, yeah, your oral hygiene is good, but then only some food particles got stuck in your tooth. That too on the back side of the tooth. Okay, when you brush it, you do it in a proper way so that they'll get removed off.
Thank you.
What's your name?
Harshini.
Which class are you?
Now present 10A.
Okay. Now you have finished your 9th exams and
I'm 10.
what's your age?
Age 15.
Okay. Do you have any problems with your tooth? Do you have any complaint regarding your tooth?
No.
Okay. Just open your mouth. Just open it a bit more. How much time do you brush your teeth once in a day?
10 minutes.
10 minutes. There's no need of brushing for 10 minutes. It is okay if you brush for 5 minutes too. You don't have any problem with your tooth. Maintain the same way you are maintaining, but brush it in a proper way, okay? Brush it like you sweep your tooth and brush it. Don't do it in a horizontal way. Just sweep and brush it. Okay, there are no decay or any dental caries to your tooth. Everything is fine. Maintain in the same way. You can. What's your name?
My name is Wasim.
How old are you?
I'm 13.
Open your mouth.
Ka pit and fissure caries 3. Bite.
How I didn't understand.
See, like this.
Yeah.
Like this. How I am biting, you see. Bite with your posterior teeth. Bite with your back teeth. Okay. Buccal pit 3. Okay. You have a caries in this tooth. You have a caries.
Okay.
It is in a starting stage, so that we can arrest that with restoration. We'll write a card. You come to our college.
Okay.
Bar Institute of Dental Sciences from Takkalpadu, Guntur. So yesterday we have celebrated World Health Day, that is on 7th April 2025. So this year, every year, WHO means World Health Organization, every year they'll give a theme based on our health conditions, okay? This year theme is Healthy Beginnings and Hopeful Futures. So do you know what's the meaning of this? Healthy Beginnings, Hopeful Futures. Can anyone explain about this?
Beginning healthy means starting healthy life.
Okay.
And hopeful futures means giving hope hope to the futures.
Okay. By what? How? Through health. So can you explain this picture? So you just explain what is this?
Mom carrying a child.
Holding a child with her hands. That means this is mainly based on maternal and child care. Maternal health and child care. Maternal health means, so if a mom is healthy, then he will take care of her, she will take care of her child, right? So that's the healthy beginning, hopeful future. So she will carry that health conditions and that she will promote those things to her children. Okay, so like means not only through mother and child, if we start our beginning healthy, that means if we start our healthy lifestyle, there will be a hopeful future. That's also the meaning, right? So this is the theme this year they have given. So let's all start like this. Okay, healthy beginnings, hopeful futures. Okay. Can anyone translate in Telugu? Very good. Then ఆరంభమా ప్రారంభమా? ఓకే, ఏదైనా ఒకటే. హోప్ఫుల్,
ఆశాజనకమైన భవిష్యత్తు.
ఆశాజనకమైన భవిష్యత్తు.
సో మీరు హెల్దీగా ఇప్పుడు ఏమేమి చేయొచ్చు? మార్నింగ్ యోగా ఎక్సర్సైజ్ చేస్తున్నారా? మెడిటేషన్, స్ట్రెస్ రిలీవింగ్, అంటే మీరు 10th ఇంటర్ అంటే కొంచెం స్ట్రెస్ ఉంటుంది కదా, సో మార్నింగ్ కొంతసేపు బ్రీతింగ్ ఎక్సర్సైజ్ అవన్నీ కొన్ని ఉంటాయి కదా మెడిటేషన్ క్లాసెస్, అవి కొన్ని రోజులు అటెండ్ అయ్యి సమ్మర్లో మీరు కంటిన్యూ చేసుకోవచ్చు ఇంట్లో. సో ఎర్లీగా లేచి మీరు అవన్నీ చేసి ఎక్సర్సైజ్, అవి సూర్య నమస్కారాలు అవి ఉంటాయి కదా, దే ఆర్ గుడ్ ఫర్ హెల్త్ అనమాట. బాడీ అన్ని మజిల్స్ అవన్నీ బాగా బెండ్ అవ్వడం, వర్క్ అవుతాయి, ఫంక్షనింగ్లో ఉంటాయి. సో దట్ మీ బ్రెయిన్ కూడా యాక్టివేట్గా అవుతుంది ఎర్లీ అవర్స్లో లేగడం వల్ల. సో డైట్ కూడా హెల్తీగా తీసుకోవాలి. మిల్క్ తాగడం రోజు, మీరు గ్రోత్ ఏజ్ కాబట్టి బోన్స్ గ్రోత్ ఉండాలి కాబట్టి కాల్షియం అనేది ఇంపార్టెంట్. సో యూ హ్యావ్ టు టేక్ ద హెల్దీ డైట్, ఫ్రూట్స్ అండ్ ఆల్. యూ హ్యావ్ టు ఈట్ రెగ్యులర్లీ, అంటే అకేషనల్గా కాదు, ఫ్రూట్స్ రెగ్యులర్గా తీసుకోవాలి డైట్లో. సో ఇన్ బిట్వీన్ తీసుకుంటారు సో దట్ యూ కెన్ లీడ్ ఏ హెల్దీ లైఫ్ అనమాట. ఫ్యూచర్ ఆల్సో యూ విల్ గెట్ ద హెల్త్, వెరీ గుడ్ హెల్త్. ఓకేనా?
Bhargavi, today I am here to explain about how healthy we should maintain our teeth. Okay, so do you all know how many teeth do we have in our mouth? How many types of teeth? Not 4. I just asked about what are the not all primary and secondary. Do you know primary and permanent dentitions? Do you know? Pala pallu, permanent pallu. You don't know? Childhood tooth. Do you all know? Okay. Yeah. After shedding of all those teeth, we'll get permanent teeth. Okay. How many primary teeth do we have? How many permanent tooth we'll have? 32. Primary 20. Okay. So what are the types of teeth now? Okay. What are the types of teeth? I mean, 4. What are those? Incisors, canines, premolars and molars. Okay. Molars are the grinding teeth. Okay. The teeth which helps us to eat. Okay. To grind the food. Whatever food we will take, those teeth helps us to grind the food. Okay. And so I'll just explain today about how we have to brush our teeth. Can anyone explain how you will brush your teeth? Yeah, you're free to talk. Okay. You just explain. Okay, then I'll just tell how you have to brush your teeth. Next we'll continue. We have two sets, upper and lower. Okay, this is the lower teeth and this is the upper teeth. Okay, we have to take only peanut size of toothpaste. How many times, how many minutes you will brush your teeth? Very good. Ever chepparu 2 minutes ani? Nene kada cheppinu. Yes, 2 to 3 minutes we have to brush our teeth. Okay, and place a peanut size of toothpaste on the brush and take a brush and brush your teeth in circular motions. Okay, so from this is my teeth, you can expect me. So you have brush your teeth in circular motions. Okay, these are all gums and teeth. Okay, from gums to teeth downwards. Lower teeth means upwards. Okay, for front teeth you have to place your brush downwards and brush your teeth like that, like this. Okay, up also same, in the upward direction. Okay, circular motions, then upward to downward, downward to upward, downward to upward, like this. Okay, the main principle means it's just every bristle, every brush bristle should touch your tooth surface. Okay, then only you will have healthy teeth. Calculus and stains will be removed. Okay, otherwise if there is more lodgement of calculus means the teeth get mobile, so త్వరగా ఊడిపోతాయి. Okay, healthy teeth means healthy gingiva means healthy teeth. Okay, healthy teeth means healthy body. Okay,
Our oral cavity is a mirror for all the systemic diseases also.
Yeah.
So if you are from childhood onwards, if you are keeping your teeth in a healthy manner, you will not be suffering. You will not get any other diseases.
so this year World Health Organization has also given a theme. Okay, so what is the theme means? Healthy beginnings, hopeful future. So if we start our healthy food, healthy diet, by eating healthy diet, there will be a good beginning. That means hopeful future means you will get a good future in terms of your health. Okay, okay.
Hope you learn about that health.
So can anyone explain me how to brush your teeth?
Brush your teeth in circular motion for 2 to 3 minutes.
Open this jar and tell how we need to brush it for each and every tooth.
For upper gums, from top to bottom we should brush.
Okay.
From bottom teeth we should, from bottom to top we should brush our teeth, and inside we should do like this.
Inside we should do like this. Okay. All of you get
How much we have to take toothpaste?
toothpaste. How much?
Pinch
size?
of
Pinch
tooth.
not. We need to take a peanut size.
size.
Okay. Peanut size of toothpaste should be taken. Okay.
Okay, thank you.
Hello everyone, this is Harika, intern from CBAR Institute of Dental Sciences. I am here to tell you the do's for the better oral health. First, brush twice daily. Use only a peanut size of toothpaste and brush gently for 2 to 3 minutes. Visit your dentist regularly and use dental floss upon dental advice. Stay hydrated and drink plenty of water. Eat healthy diet. Eat your fruits and vegetables. Make sure to eat adequate amount of vitamin C for your gum health. Thank you.
Hello everyone, my name is Leela. At present I am doing internship from CBAR Institute of Dental Sciences. Now I am here to explain the don'ts for maintaining the better oral health. First of all, avoid taking sticky foods which may adhere to the tooth structure and cause dental caries. Avoid taking too much sugary items. Avoid smoking. Avoid taking alcohol, and avoid placement of safety pins in between the tooth structures. Avoid applying over amount of the toothpaste onto the brush. Avoid improper usage of the neem sticks, and avoid biting on the lips, the pencils. Thank you all.
Hello everyone, this is Dr. Shweta, postgraduate student, Department of Public Health Dentistry from CBAR Institute of Dental Sciences. Today we will see a small experiment regarding how the dental caries occurs in our oral cavity. For this I am using yeast and sugar and warm water. Yeast represents the bacteria that is present, bacteria or microorganisms that is present in our oral cavity, and sugars represents the foods we take which contains sugar. And first, these are the warm water. First we will mix the yeast into warm water. This yeast represents the microorganisms which are present in our oral cavity. When we take foods in which sugars are present, the yeast when combined with sugars, it converts into lactic acid, which increases our oral pH into acidic, that is more than less than 7, and it converts it helps in producing more microorganisms which dissolves the enamel surface and the caries occurs. And let's wait for a few minutes. You can see the lactic bacilli is multiplying, which means the pH is in acidic, which is less than 7.
A very pleasant good afternoon to one and all. Myself, Chakkireddy Srilakshmi, pursuing final BDS in Sibar Institute of Dental Sciences.
And I am Nikita Koturu of final year BDS of Sibar Institute of Dental Sciences. And today we are here to give a basic introduction of how to brush and techniques that we use to brush.
Actually, this model represents the mouth of a people. I mean, oral cavity of each and every individual. And in this we have two parts. One is the maxilla, which is the upper part, and one is the mandible, which is the lower part. And in maxilla and mandible, we have overall 28 teeth. And in this we have 4 types of teeth, such as incisors, molars, premolars, and canines, and each of the teeth is having a different type of morphology, and this morphology helps causes the accumulation of food into these cusps and interdental areas. And we have in oral cavity we have tooth and the gingiva. We have normally everyone will brush in a horizontal manner, but it's not a horizontal manner like this. But it's not the right way to brush, because while brushing in the horizontal manner, the toothbrush is not able to cover and touch all the surfaces of the teeth. So the debris can't be easily removed from on all the surfaces of the teeth. So the main the commonly advised technique and by the dentist for the patients is the modified bars technique. And for the pediatric individuals, we advise the circular motion of brushing. The circular motion of brushing, in circular motion of the brushing, that if we assume it's a tooth, it covers all the surfaces of the tooth and all the debris can be removed from all the surfaces of the tooth. In the adults, we used to advise the modified brass method, where we place the toothbrush at a 45 degrees angulation to the tooth surface, and we start doing brushing with a sweeping motion, and so that the brush starts from the gingival surface and it ends up to the occlusal surface of the tooth. Here it is the gingiva. it is gingiva, and this is the occlusal surface. So the brush should be started from the gingival surface and it should end up to the occlusal surface. So in the teeth we have the outside seen surface is the buccal surface and inner surface is the lingual surface. Usually the most common thing is the food will be more commonly accumulated in the mandible near the lingual surface. So in lingual surface we need to clean the food by vertical motion, vertical sweeping motion. So it starts from the gingival surface and it should be done with a sweeping motion, and it helps in the oral keeping removal of all the food debris, and this helps in a keeping the good oral hygiene. A good we have a note that a good oral the oral cavity reflects the health of the individuals. So happy smile will leads to a happy day. Thank you, Ananta.
Hello everyone, we are the final year students from Sibar Institute of Dental Sciences. Today we are here to discuss about the progression of caries. We have 4 types of teeth in our oral cavity, that are incisors, canines, premolars and molars. This is a model representing molar. So the layers of the teeth are enamel, dentin and pulp. Pulp have nerves and blood vessels. The progression will be continued. So basically the tooth have 5 surfaces: the occlusal, the proximal surfaces like mesial and distal surface, and the buccal surface and the lingual surface. The caries can progress in any one of the surface, and initially it starts in the enamel and later on it progresses to the dentin, which has mild acute pain, and it is known as the reversible pulpitis, and later on it progresses to the pulp, which has nerves and blood vessels. It is known as the irreversible pulpitis and it has severe pain. Later it is continued by the tooth.
I have discussed about the treatment plan of the dental caries. Initially, if the caries is present only in the enamel surface, it also presents with the discoloration of the tooth. The discoloration may be inside the tooth or it may present externally. If the discoloration present externally, we have to diagnose earlier. That means there is no pain. If it has pain, the progression continues to the pulp. If it has continues to pulp, we have to do 2 treatments. One is initially we have taken analgesic for the removal of pain, and later we have take antibiotics. Antibiotics for the infection that may be present within the pulpal area. If the progress to periapical area, that means that the area which is present at the apical area of the root portion, we have to do root canal treatment. If it progresses further away from the periapical area, we have seen an infected area. That means there is a radiolucent area in radiographic regions. So we have to do the root canal treatment. If it progresses further, we have to advise the patient for doing an extraction. Thank you.
Thank you.
Hello everyone, I am Dr. Sushna.
I am Dr. Bhargavi.
We are postgraduates in Department of Public Health Dentistry from Sibar Institute of Dental Sciences.
Today we are here to explain about the myths and facts in the dentistry.
I am going to talk about myths.
I will break the myths.
The first myth is extracting upper teeth will damage our eyes.
No, extracting upper teeth does not damage your eyes, as the teeth are present very close to the eyes. They are anatomically close to each other, so they are not directly connected to each other.
Scaling can cause our teeth loosen and create gaps between the teeth.
No, scaling will improve our gum health. As we remove the debris or calculus from the tooth surface, they will create a gap in between the tooth surface.
Brushing harder cleans the teeth better.
No, brushing gently with good technique is more effective.
Children's teeth are not important because they eventually fall off.
No, they are important for the development of healthy permanent tooth. Thank you.